Diabetes is a disease that affects how your body uses sugar. Sugar is like gasoline for your cells. When you eat, your body turns food into sugar. Insulin, a hormone made by the pancreas, helps your cells use this sugar for energy. Sometimes your body doesn't make enough insulin or it doesn't use it well. This is called diabetes. When this happens, sugar builds up in your blood, instead of going into your cells. Over time, high blood sugar can damage your organs. There are two main types of diabetes. Type 1 diabetes happens when your body doesn't make any insulin. Type 2 diabetes is the most common. It happens when your body doesn't use insulin well. High blood pressure, also known as hypertension, is like having too much pressure in your blood vessels. Imagine your blood vessels are highways, and your blood is the cars on those highways. If there are too many cars on the highway, it creates a traffic jam and increases the pressure on the road. High blood pressure forces your heart to work harder to pump blood. Over time, this can damage your heart and blood vessels. Often, high blood pressure has no symptoms. That's why it's called the silent killer. Many things can cause high blood pressure, like family history, being overweight, eating too much salt, and not getting enough exercise. Family history, being overweight, eating too much salt, not getting enough exercise. Diabetes and high blood pressure often go hand in hand. They're like two partners in crime that can seriously damage your health. If you have diabetes, high blood sugar damages your blood vessels, making them stiff and narrow. This makes it harder for blood to flow, which causes high blood pressure. On the other hand, high blood pressure can make diabetes worse. It puts extra stress on your kidneys, which are already working hard to filter out excess sugar. This can cause kidney damage, a common complication of diabetes and hypertension. Diabetes and high blood pressure are especially dangerous because they can damage vital organs in your body. Let's take a closer look at how this dangerous duo affects some key organs. As for your heart, high blood pressure makes it work harder, which can lead to heart failure. Diabetes increases the risk of fatty deposits that clog arteries, increasing the risk of heart attacks and strokes. Your kidneys are in charge of filtering your blood. High blood sugar and high blood pressure damage the small blood vessels in your kidneys, causing kidney disease. In severe cases, this can lead to kidney failure, which requires dialysis. As for your eyes, high blood sugar damages the tiny blood vessels in your eyes, causing diabetic retinopathy. This can cause blurry vision and even blindness. High blood pressure makes this damage worse, increasing the chances of vision loss. Finally, both diabetes and high blood pressure increase the risk of stroke. High blood sugar can damage the blood vessels in your brain, while high blood pressure can cause a blood vessel to burst or become blocked. This can cause brain damage, affecting your ability to move, speak, or think clearly. The good news is that you can do things to lower your risk of diabetes and high blood pressure, and to manage these conditions if you already have them. Here are some tips for a healthier life. Eat a healthy diet. Focus on fruits, vegetables, lean protein, and whole grains. Limit sugary drinks, processed foods, and unhealthy saturated and trans fats. Exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. You can brisk walk, swim, or bike. Maintain a healthy weight. Losing even a small amount of weight can greatly improve your blood sugar and blood pressure. Take your medications as prescribed. If you have diabetes or high blood pressure, it's very important to take your medication exactly as your doctor prescribed. Get regular checkups. See your doctor for regular checkups even if you feel well. This helps catch any problems early. Remember, knowledge is power. By understanding the link between diabetes and high blood pressure and by taking steps to live a healthy life, you can greatly reduce your risk of these conditions and protect your overall health.